everyone, so my name is Krystal Rojas and this will be my very first video on my YouTube channel. The reason why I'm making this video is to inform everybody about my breast augmentation. I did tell a lot of people on my Instagram as well as my Facebook that if you had any questions in regards to my breast augmentation to ask them, and me and my surgeon will answer them for you on this video. You will see him right here in a little bit. I'm going to head that way actually right now after I make this video. So the reason why I got my surgery was at the time I was doing boxing as well as I was working out 2 times in addition to boxing a day. So basically I became really tiny and I just didn't like the way I looked anymore because I did have bigger boobs and I did fill my clothes more. So once I saw that big difference, I didn't feel comfortable anymore. And a lot of people did comment, were like, oh, you look better before, and I definitely appreciate that. Thank you so much, but I'm happy now and I feel like that's what matters. I wouldn't take it back. I'd go back again and of course back to my surgeon, which I will be doing in like 10 to 15 years when I have to go back. So I did actually have my surgery on April 24th of 2018, so coming on 2 years, and they still look great, I think so at least. And I went 475 cc under the muscle, and then they went through like right under the folds of the breast. And I went from a 34B to a 34 triple D. The reason why I went to my surgeon is because right off the bat, I could tell he cared about me. I wasn't just another patient. I wasn't just money in his pocket. Him and his staff treated me really well. They answered all my questions. They made sure I was comfortable. You know, they definitely put me first. They always called me to check in on me. They were up to date with all their appointments. They made sure that, you know, basically I had the best experience ever. There was even a time after the surgery that it was like Sunday, 8 p.m. and I was like bruised pretty badly, and I was actually scared because the bruises were purple and I was supposed to be getting better. So I actually called my surgeon and I was like, hey, this is what's going on. And he told me basically like, it seems normal, but if you want to come in like right now, if you want to schedule something for tomorrow morning, we can always do that. And I can go ahead and look at this, but I did send him like pictures and he was able to see and be like, no, that's normal. You know, sometimes you move a little bit because you're not supposed to move too much. And, you know, that's what causes like the bruising basically. And so, yes, reasons like that is definitely what got me to want to be with him. And I'm very happy that I chose him and I don't regret it, like I said. Another reason was the anesthesia that he used. It's called MAC, or monitored anesthesia care. So what this is, that you're basically still like conscious, but you're just like groggy or sleepy during. So if they give you like instructions, that you can still react. And that was a big thing for me too, because I didn't want to be put all the way to sleep. Like that definitely scared me, and that scared me going in, where like, but they definitely made me feel comfortable about it. Also, the anesthesia is administered through the IV too. So it's like I just went to go lay down, and then I saw him like inject something, and he was like telling me about it, and then he's like, okay, you're just gonna lay down and we're gonna strap you. And the next thing I know, I like wake up and I have boobs, and I'm like, what? This is crazy. After the surgery, it was like horrible. Like I was like hunchback, and I actually had my ex at the time and my mom take care of me, and they took very good care of me. Definitely make sure that if this is a surgery that you want, that you have somebody take care of you, because it is hard to move. My mom showered me. I don't want to tell anybody that, but my mom showered me. Like it was really bad, but it gets better and I'm happy now, and I'll definitely go back again, like I said. And yeah, so the next video you'll see is with me and my surgeon and all the questions that you asked us. And if you have any more questions, reach out to him, reach out to me. I will put his information down below. Bye. Okay, hi guys, my name is Krystal, and this is my surgeon. His name is
Dr. Olson, Josh Olson.
And he is located in Gilbert. We were just going to do an interview about all the questions that you had asked me, and we'll go ahead and get them answered for you. If you have any more questions, you can always visit him in Gilbert. So did you want to start?
Let's have you go first, and then I'll take it from there.
Okay, so where do your surgeries take place?
So most of our surgeries are in our office. We have a surgical suite where an anesthesiologist will come and administer the anesthesia, and able to perform the surgery here. It just makes it a lot simpler, have the same staff, and you know, patients do great. So occasionally I'll go to a surgery center or the hospital, depending on the type of surgery, but most of the surgeries are going to be out of my current office in Gilbert or at our surgery center in my Scottsdale office as well.
Perfect. How long have you been certified?
So after you finish residency, it's about a 1 to 1.5 year process to get board certified by the American Board of Plastic Surgery. So I've been certified for about 5 years now. I've been on my own for about 6.5 years.
Awesome. And then where did you get certified?
So I trained at University of Utah in Salt Lake City, and that was my plastic surgery residency. And after my training, I went down to Brazil and Rio de Janeiro. I worked with Ivo Pitengui, who's the most well-known plastic surgeon in the world. Got some additional training in Brazil.
That's awesome. Yeah. And then, so for breast augmentation, can you still produce milk afterwards?
Yeah, so it's a pretty common question for patients who are wanting to have kids later on. You know, the implant really sits behind the muscle, behind the breast, so it doesn't affect your ability to breastfeed.
And then what is the most complication you've had during breast augmentation?
So during the surgery, we really don't see any complications. It's a pretty straightforward procedure. Our anesthesiologists are wonderful. And so I've never had a complication during surgery when it comes to breast augmentations. After surgery though, you know, these implants are not permanent. So the most common complication for that would be capsular contracture. That's just where your body is going to naturally form a layer of scar tissue around that implant. And that scar tissue, just like scar anywhere else, can contract. And if it contracts around a breast implant, it actually will push that implant upward and create kind of an abnormal shape. And so that risk of that's about a 13% chance in 10 years. And so that's probably by far the most common thing that we'll see.
Sounds painful.
Most of the time it's not painful, it just looks different.
Yeah.
There is kind of a stage 4 capsular contracture where it can be uncomfortable or painful, but usually it just looks a little goofy.
How do you notice that?
Just looking in the mirror, one breast will sit a little bit higher than the other. And sometimes the breast will actually kind of start to fall off the implant, and sort of just looks a little droopy in a way, so it just changes the shape.
Okay. And how would you handle that?
So yeah, in every practice will be a little different on how you deal with complications after surgery. If it were to happen within the first couple of years, typically there'd be no charge to the patient to correct that. The implant company will often give you a free implant to help with the overall charges. My part would be free, and so the treatment is to cut out the scar tissue and put a new implant in. Risk of that happening the first couple of years is probably 1 to 2%. It's very low. If it happens years down the road, it's really a new surgery. It's going to be cutting out the scar tissue, putting in a new implant, and that's kind of the nature of breast implant surgery.
Awesome. What's the difference between silicone and saline?
So the saline implant is actually covered by a silicone shell. It's heavier, it ripples more, gives a little bit more of a firmer, unnatural shape. And so silicone is by far more common. About 90% of breast implant surgeries in the US are going to be silicone. So I use majority silicone. It's softer, it feels more natural. Especially with the newer cohesive gummy bear implants, it's just a much better product. So not really need to do saline unless patients want to save some money.
Okay. And then what's the difference between a lift versus the implants?
So if you have to do a breast lift, it really is just going to change the overall shape of the breast. You know, if you've had kids and had a history of weight loss, a lift is going to pull the breast up onto where the implant's going to sit. Out of a bra, obviously it's just going to look a lot better. We are trading some scars for that better shape, and so the recovery actually is probably no different. The main discomfort or pain from a breast augmentation is going to be stretch on the muscle or stretch on the tissue. So the lift itself really doesn't change your overall discomfort or time off work.
Okay. What is recovery time?
I usually tell patients about 3 to 5 days of pain medication. Everyone's a little different. Oftentimes we'll have patients come in 2-3 days later and they're already off pain medication. Sometimes people on pain meds for up to 5 to 7 days, but I'd say in general 3 to 5 days, back to work in about 5 days for most, depending on the type of job.
Yeah.
How was it for you?
It was painful for like the first week.
Yeah,
I was depressed. Yeah.
I think if you've never had surgery before, it's a little bit of an eye-opener.
Yeah.
Patients who've had C-sections and other, surgeries in the past, and something to compare it to, I guess.
Yeah, I was like hunchback for like the first week. It was horrible.
Really? Yeah.
What's the we already said that. The cost.
So cost for a breast lift with implants is going to be more. It just takes usually 2.5 to 3 hours for a breast lift with implants. So you're probably looking at anywhere between $10,000 and $13,000 for most surgeons. If you're looking at just implants alone, probably between $5,500 and $7,000, kind of depending on the surgeon.
Do you have any specials?
We usually don't do specials for surgery itself. Occasionally we'll run a breast augmentation special, but it's been a couple of years since we've done that. We're typically booked out a few months, so we usually do specials more for the med spa, that sort of thing.
Okay. Referrals.
What about referrals?
Big discounts with referrals.
If patients come in together with a friend and they say, hey, we both want to book together, usually my patient coordinators will probably offer them some sort of discount if they both book at the same time. Oftentimes we get so many patients that are happy with the overall experience or results, and so they refer patients just because they want their friends just to have the same experience. In general, we might give them a hydrofacial or some sort of spa treatment, but we don't have really a set program. We feel like, hopefully patients are happy and they want to, share that experience with their friends, and, that's worked out well.
Perfect.
We definitely appreciate the referrals, obviously, but, kind of goes both ways.
Pain medications, how many?
That's obviously evolved a little bit with just the better understanding of the risk of opioid dependence, and you hear that a lot in the news these days. And so in general, we give between 30 and 40 pain pills for the recovery. And I'd say it's rare that we have to give a refill, but really people should be on pain medication within a week.
Right, and then if you have more pain, you can take like Tylenol or something.
Yeah, so some surgeons will be against Advil or ibuprofen for the first few days, which is fair because you're worried about bleeding. In my experience, after about 3 days, you're probably fine to start doing Advil or ibuprofen, and then you can add Tylenol if you're off the pain medication as well. So usually after 3 to 4 days, we're going to switch you to those.
Okay. How long do the implants last?
The recommendation is to exchange them at 15 years. If you have no problems at all, I'd say leave them in for 15 years. The rupture rate does start to go up over time. The risk of capsular contracture does go up over time, and so somewhere between 10 and 15 years are really when we're seeing patients back. We definitely see patients who've had it for 20 or 30 years. The rupture rate's very high, the complications are higher, the surgery is a little more difficult. So I definitely recommend not waiting forever.
Yeah, I saw the one on your story for like 30 years. I was like, what is this?
We definitely see a lot of, I think back in the day, surgeons would tell patients they last forever, and that's definitely not the case. Fortunately, implants are much better than they were back then, and so hopefully the ruptures aren't as bad. But still, at 15 years, you probably should have an exchange.
And what implant placement gives the most natural look?
Definitely under the muscle. So the pectoralis major muscle will cover the upper pole. It kind of helps flatten that or make that a smoother contour. If you put the implant on top of the muscle, especially if you're very thin, you're going to really see the definition of that implant. It doesn't look good.
Yeah. What's the best incision site?
So with newer studies that we've seen the past several years, the risk of capsular contracture is higher if you go through the nipple area. So nowadays, most surgeons are going to recommend going underneath the crease. You can go through the armpit as well. In my experience, the lowest complication rate is through the intramammary fold, which is underneath the breast.
Yeah, that's what I did.
Okay.
How's the scar?
Usually the scar heals really nicely. It's going to lighten up over time. It's about 3.5 centimeters long. If you go with a much larger implant, you have to have a little bit of a bigger scar. If you have a saline implant, you can have a smaller scar just because you put in the empty bag and you fill it up. But usually 3.5 centimeters, and I'd say it's rare that you see that scar afterwards.
Is there a consultation cost?
So we charge $50 for breast augmentation consultations. If you're doing like a tummy tuck or sort of more extensive surgery, then I think they charge a little bit more. That fee does apply to the surgery itself, so it's not lost if you book surgery.
Perfect. And then have you had any revisions of your own work?
Of course. I think if any surgeon says no, then they're lying to you. I think it's rare that we have revisions, but I think patients get capsular contracture early on. Within a year, they're going to get a revision. There's always a small risk of implant malposition, especially implants that are too big or based on their anatomy. If you're having to really lower the fold to create a better shape, there's a higher risk of that implant dropping a little bit further. So, I would say our risk of revisions is probably 1 to 2% within the first year. With other operations, are you talking more specific breast implants or any other type of surgery?
Implants.
Yeah, so it's rare that we have to do revision, but I'd say most commonly it's a capsular contracture.
And that's it.
Okay, so I'll ask you about your experience. How long ago was your surgery?
It was April 24th, 2018.
2018. Okay. And overall, happy with how things turned out?
Extremely happy.
Perfect. How big did you go?
475 cc.
Okay. Do you wish you would have gone bigger or smaller?
No.
Okay.
No.
Happy with
yeah,
that?
I think I look normal. Like I don't
Perfect.
look like I'm falling over.
Right. There's definitely a balance there. So that's, and do you feel like that's changed? Like early on you thought you should have gone bigger, but then as you got used to them, you're happy with it, or all along?
No. Early on, I was like, I should have gone bigger.
Yeah.
I really wanted to, and then I saw like other people, because I was like in a group chat, and they're like, "Oh, we're going bigger," but then they had complications after, and I was like, I'm happy I didn't do that.
Yeah, it's good for everyone to know that. I mean, there are some downsides to going large, and I think long term it makes the breast tissue thinner, definitely heavier, more uncomfortable. So
and I think we spoke about it too, because originally I wanted like 450 cc, but then I was like, wait, can we go a little bit bigger? And you're like, if we can, I'll do it, but if not, we're going to stay.
Decided surgery. Perfect. And then why did you have a breast surgery?
Because I was working out like a lot at the time, so I felt like I was too skinny, and I didn't like the way I looked when I was looking in the mirror.
Just kind of more proportional.
Yeah.
Okay, and did you do silicone or saline?
Silicone.
Okay, very good. Do you feel like they feel natural and no problems there?
Yeah, but they're not as soft, but you can definitely.
You can tell.
Yeah.
How was your pain afterwards? We talked about that a little bit, but
yeah, it was horrible at first.
Were you taking the pain medication all week long, or when did you think you kind of stopped that?
After like the 4th day, because I was like, this is too relaxing. It's probably dangerous. I shouldn't be on this. Yeah.
Okay, that's good to be aware of that.
Yeah.
And how was your recovery overall?
It was really good. The only thing that bothered me was that I couldn't like lift my hands over my head forever.
Right.
I would like go to the bathroom and like have to stand on the toilet to get like the protection. I was like, but besides that, it was good.
And I think after the first week, you probably should be able to put your hands up all the way, but it probably is uncomfortable, and kind of get a feel for it. All right, and then so how was your overall experience with the surgery, recovery?
It was great. I think I was like really scared at first, like when I first walked in.
Yeah.
But then I talked to your nurse about like the anesthesia, and she like made me feel like really calm. She's like, "Oh no, it's not that big of a deal. Like it'll be fine."
Yeah, I think our nursing staff is great, and we always get a lot of positive feedback there. And so that's another benefit of kind of having a surgery center in our office is, we can it's the same staff that sees the same patients over and over again, so they really can help kind of put the patient at ease. And so let's see, what was your biggest fear before surgery?
Dying on the table, to be honest.
Yeah, that would not be pleasant. Fortunately we don't see that, and so overall, having a good anesthesiologist obviously is keeping you safe.
Yeah.
And then why did you choose me as your surgeon?
You made me feel comfortable and not just like another number. Like you actually were like personable. There were like other doctors that I saw that were like, okay, like let's get this done. It's this much money, let's go. But they didn't give me any information. Okay. Like, you actually sat down and talked to you.
It's an important decision, and definitely the FDA has come out saying patients really need to be informed, about the procedure, about long-term risks. And so, I think we try to do a good job about really informing the patient.
Yeah, and your stuff too, like Patty, she was really good at it.
Perfect. Yeah, it's great to hear. Okay, very good. Thank you for your time.
Yeah, thank you. Thank you guys. Bye.